5 silent killers men just continue to ignore. Too many men are taught to just keep pushing through. Yeah, y'all heard the phrase "man up," right? Y'all in pain, man up. Y'all in this discomfort, man up. Like, just get through it. Just get over yourself. Like, too many of them are not taught to, hey, something's not feeling right. Let me go find out what the something is immediately. No, that's not us. All right, so today we have to talk about some of the risks that men continue to ignore until it's a problem, right? And again, obviously, again, with Men's Health Awareness Month, we're going to be very gender specific, right? But again, for my ladies, you can definitely hear some of these. This may hit across the bow on both sides, but this month is all about the men, of course. So we are going to talk about some of the risk factors, risk issues that they are facing, that the system is, again, kind of setting them up to fail, and they're failing miserably, right? Again, we know the numbers, right? 40% of y'all don't go to see the doctor. Majority of y'all are just avoiding any health care at any especially preventative standpoint. I should say preventative, because when y'all get really sick, y'all end up and then y'all overuse it. But preventative wise, y'all are avoiding it to the tip top shape that you can, and more importantly, it's causing the gap. This terrible gap in terms of who is dying first, right? So we're going to talk today about some of these big issues that I see happen over and over again, whether it be systemically, whether it be from a personal choice, whether the 5 killers that seem to be really kicking our butts that we seem to just be ignoring, and I don't know why. Again, I'm yours truly, Dr. Barry Pierre, board certified internist, host of Medicine Mondays, the Lunch and Learn with Dr. Barry podcast. Right, so let's talk today. Let's have the conversation today that I hope gets us so energized that we do not play any more games from here on out. When it comes to our health, we are not playing any more games from here on out, because we want to make sure that in 10 years, 20 years, 30 years, we are still around doing what we need to do in the most healthiest state of mind that we can be in. So today, by the end of the video today, we're going to talk about 5 silent killers men just continue to ignore, right? Now, let me be clear. They're silent for a reason, right? Because a lot of y'all are avoiding seeing us in the office because you feel fine. That's what silent killers do. They make you feel fine until they can't. Our body does a great job. Our body and our mind, 2 things that do a great job at having us ignore when the fire is around. Our body say, hey, I got this. I'm gonna just throw some water on it. I got this. I got the fire extinguisher. Oh, that whole house is burning. Like, this is on you, right? This is what our body does, right? Like, it tries to put out the fire when it can. It tries to stomp it out. It tries to throw some water on it. It tries to spray the little fire extinguisher. But then it gets to the point where the whole fire takes over the whole house, and it says, hey, peace out on you. And then stroke, heart attack, dialysis, like everything under the sun that should be under the sun. And that's when you come to see us, right? When the symptoms are just showing up, even though they're there, but you ignored it because you were able to ignore it, right? So let's talk about this, right? Let's talk about the fact that too many men, right? And I say this all the time, and it's because it starts when we're young. Too many men are taught to just keep pushing through. Yeah, y'all heard the phrase "man up," right? Y'all in pain, man up. Y'all in this discomfort, man up. Like, just get through it. Just get over yourself. Like, too many of them are not taught to, hey, something's not feeling right. Let me go find out what the something is immediately. No, that's not us. It's something not feeling right. Hey, can you still walk? Can you still get up? Can you still get to work? All right, yeah, get to work. Right, we'll deal with it later. And that has continued to be this recipe for a disaster that continues to allow us not to be aggressive when it comes to prevention. And when we're not aggressive when it comes to prevention, guess what? All of these health risk factors that I'm going to talk about, like, they rear its ugly head, right? So that's really the issue at hand, right? Because when we think about it, and I like this because I saw this quote, right? Health issues do not always start when sirens are flashing. They start in the background. A blood vessel stiffens, sugar stays elevated, plaque builds in arteries, a tumor grows silently. Like, let's think about this. Let's think about that. right? Like these are when the silent killers are silently killing you, it's because guess what? Right? Like all these things that are slowly happening are happening under the hood. And you don't know what under the hood looks like because you've never went to the car shop and to say, yeah, you know what? I hear that sound. It don't sound right. I see that check engine light. It don't look good, but I'm gonna keep on going. Okay. Like, could you imagine a lot of men out here do a better job with their maintenance of their cars than they do the maintenance of their bodies? Right? Maintenance of their cars. Oh, I need an oil change every, 3,000 miles. Boom. Like they don't let 3,001 go by. Hey, you know what? The grass in their yard is getting a little bit taller. Boom. Let me go maintenance that. Right? We do maintenance for everything else until it comes to maintenance for our health. And then all of a sudden we're like, we'll just get to it. I feel fine. That's okay. Not no more. Not no more. Right. That's the problem. Right. We're not gonna let that happen. And because we're just not gonna let that happen. Right. Like, again, you follow me. Right. That's why you follow me. Right. Because you do not want to continue to go on the path that you may be going, or you want to make sure you're on the right path. There's two reasons why you follow me. You're trying to get on the right path when it comes to healthcare, and you want some educated, peace of mind, someone who isn't going to just hit you with medical jargon over and over and over again, right? Someone who, like, you can actually understand when they're saying stuff, right? Versus like the person who just talking this medical jargon and talking over your head and not giving you a chance to get any feedback. Like, that's why you follow me, right? So we're going to make sure, right? Especially, again, this is Men's Health Awareness Month. This is our month. And if we want to be around in 5, 10, 15, 20 years, right? And not just be around, be as healthy as we can be, like, this is when it starts today, right? So I always talk about, again, I always bring it back, right? When we think about when I was a medical resident at Columbia, and I remember just taking care of this father, right? He was in the hospital, right? Taking care of this father in the hospital, suffered his first heart attack. And I just remember talking to him and trying to, because he was like 45, he's in his 40s, like probably late 40s. And I just remember talking to him, right? Because again, I'm looking like, all right, this guy, late 40s, got a heart attack. I'm a little selfish. I'm be honest. I'm gonna be honest, right? This is honesty hour, right? I'm gonna be honest. A lot of times, my motivation, right, for getting healthier is the patients I'm taking care of, who I'm like, oh, you know what? That could be me in like 2 to 5 years, right? In fact, that person looks like me, right, in 2 to 5 years if I don't stop playing. A lot of times that'd be my big motivation. Y'all are my big motivation to making sure I'm right? I'm getting myself together. I'm getting my checkups, because I see too many of people who could be me in 3 to 5 years, right? With a heart attack, with a stroke, with cancer. I'm seeing way too many, and I don't want that, right? I want to avoid it. Again, I want to be aggressive on the prevention side than rather be aggressive on the treatment side. I don't throw the book at me like once I get the disease, right? Which is one of those things where I thought it was very weird, right? Just a COVID segment where I would have had people who are anti-vax and anti-everything prior to getting COVID. They get COVID, they get in the hospital, and all of a sudden, doc, do everything. Give me every medication under the sun. I want to live. And I'm like, you want to live, but the preventative things that you could have been aggressive with, you said, I don't believe in it. But now that you got the disease, now you believe in all of the treatment. Again, very weird to me, but neither here or there, right? So I'm speaking to my patient, and he's just kind of giving me the conversation. I'm just like, oh, well, I mean, didn't you know you had high blood pressure? Didn't you know? Like, he had all of the risk factors to have a heart attack. This wasn't a person who had a heart attack and like we should be shocked that he had a heart attack. Obese, hypertensive, diabetic patient. Ching, 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 ching. Like, check mark, check mark, check mark. And a smoker, check mark. Like, all of the risk factors to get a heart attack, this guy should have had a heart attack. But he was still shocked that he had a heart attack. And I had to educate him on why you should not be as shocked that you got a heart attack. So I asked myself, what happened? Like, you didn't get a checkup? You didn't, like, no, I didn't. I felt fine. I felt fine, right? That feeling fine is getting us in trouble, right? There is no feeling fine. Do the numbers say I'm fine, right? I always say, I don't want to hear about what you feel. What do the numbers say? What does the data say? Does the data say you feel fine? Does your blood pressure, your weight, does your labs, does all of those say you're fine as well? Because when those are fine, then I'll listen to you tell me what you feel. But if you just say that you feel fine, and the reason why I feel fine is a problem for me is because a lot of y'all will have some aches and pains and y'all avoid it. A lot of y'all will have a change in bowel habits, but y'all avoid it. A lot of y'all be having things that are not really fine, but in your mind, because you think it's fine, like you just kind of go with the flow. No, that's not the case here, right? So again, I'm talking to my patient and I'm just trying to educate. I'm trying to get him to the point where he understands that there are some things he could have done to prevent him from seeing me today. And that's why we're having this conversation, right? There are some things that could be done, that should be done, that will be done after you watch this video or listen to this podcast episode, that you know that, like, all right, let me stop playing games, right? So let's talk about our 5 killers, right? Let's talk about the 5 silent killers. Y'all hear about this all the time. I talk about this number 1 all the time, right? What do y'all think number 1 silent killer is? I'll pause for a second to give y'all that. What is the number 1 silent killer? Dr. Pierre always talks about. It's almost like a quiz question. If you've been following me since Dr. Pierre's blog, you know the answer to this question. In fact, if you go to drbarrypierre.com and you search silent killer, this likely pops up. All right, that was enough time. High blood pressure. Number 1, high blood pressure. Number 1, high blood pressure. Classic silent killer. Classic state of feeling comfortable because you don't have any symptoms, but it's killing your body on the inside. And so how do you avoid it, right? You got to know what your blood pressure are. A lot of y'all, again, I say this all the time. When we had our episode a few weeks ago about, knowing the screenings, in your 20s, you should know what your blood pressure is. In your 20s, in your 30s, in your 40s, in your 50s, you should know what your blood pressure is. That is how important blood pressure is, right? Because blood pressure is that silent killer that it could be kicking your butt in your 20s and you don't even see the effects of it till you turn 40. You don't even see the effects of it till you turn 40. But you don't let it beat your butt up for 20 years, right? Because you'd avoid it, right? So blood pressure, right? Again, shows up as stroke, heart failure, kidney disease, everyone, and no one sees it coming. They never do. Number 2, right? Silent killer, heart disease, right? Number 2 is, and when we think about heart disease, right? One of the biggest threats to men's health is always and will be heart disease. Family history is a big thing. Symptoms is a big thing. Some of your biggest risk factors for heart disease include high blood pressure and diabetes, right? Which again leads us to number 3 as a silent killer, diabetic. Right? Family history when it comes to diabetes, but you got to know your numbers. So when we talk about heart disease, knowing your numbers, when it comes to cholesterol, knowing your blood pressure, knowing your family history, big thing to do, right? When it comes to diabetes, I'm gonna say the same thing. Knowing your blood sugar, knowing your A1C, knowing what your dietary intake and output is looking like, knowing what family history you may have that could carry some extra weight associated with, right? This is what we do, right? It's one thing to know the disease, but then what do you do about the disease, right? I know it's diabetes. What do I do about it? I got to know my blood sugar. I got to know my A1C. I got to know my family history, right? I got to know what my dietary input and output is looking like, right? I got to know some things, right? Now that I know the disease, right? So that's number 3, silent killer. Number 4, cancer. Number 4, cancer, the C word that no one likes to talk about until it's too late. No one is aggressive when it comes to being the preventative aspect of it, right? Like I want us to be as aggressive when talking about cancer when we talk about prevention than we are when it's like, doc, give me everything, radiation, chemotherapy, cut it out, whatever the thing that needs to be done. Like we'll go balls to the wall, right? When it comes to treatment, but we don't put that same energy and effort to try to prevent this thing, right? So cancer is such a big thing. Obviously, this is when we're getting our age-appropriate screenings, colon cancer, prostate cancer, lung cancer. Like this is when we're getting our family history together because sometimes our age-appropriate screenings for one person is not age-appropriate for another. I want y'all to understand that. An age-appropriate screening, especially in regards to cancer, may be appropriate at that age for one person, but it may not be appropriate for another. If you have a family history, right, significant family history, early family history, guess what? All of a sudden, your time schedule shifts, right? Versus a person who doesn't have family history, who doesn't have these things there. They may be able to get it during the quote unquote regular time frame, but you can't get it if you got some family history that says get that thing earlier, right? And number 5, this is the big one. Men, we have to be honest with ourselves, right? A lot of us are walking around depressed. And because as a child, you've been told to man up, you don't know how to talk, you don't know how to be emotionally open, emotionally available, you don't even know how to experience and how to even communicate what you're feeling. So it's typically communicated the way you know, which is like anger, right? And violence and avoidance and all these things here. But no, not no more. We're not gonna do that here. Understand depression is important. Mental health is important, right? So what do you do, right? You got to recognize what mood am I in, right? That's why I talked about on the episode prior when I talked about understanding what your mood is. The 5-minute checkup with yourself is, all right, how am I feeling right now? Ask yourself that. How am I feeling right now? Am I feeling good? Am I feeling bad? If I'm not feeling good, why am I not feeling good? Did something happen? Like, you should be able to ask yourself these questions, right? So again, this is the big thing for me, right? Understand that when you have all risk factors against you, right? Whether it be your gender, whether it be your age, your race, and then you have these disease processes against you, right? Whether it be hypertension, whether it be diabetes, whether it be heart disease, whether it be cancer, or whether it be just depression or just mental health in and of itself. When you have these factors around you, right, this is how we end up dying younger than the women, y'all. This is how we end up dying younger than women, right? Because we just ignore these significant health issues that like are affecting us. I don't want y'all doing that no more. Like, I don't want y'all be sitting there getting y'all butts kicked, right? And letting life kick your butt. And then you're avoiding healthcare system left and right. Like you're dodging the Dr. Pierre's like like the plague, right? Because you don't want an answer of what may be going on. Like, I don't want that to occur, right? Again, remember, if any of these hit you in your heart, right? If any of these hit you in your heart, make sure you hit that like and subscribe button, hit the notification bell, make sure you subscribe to the podcast, right? Or the YouTube show for sure. These are let's get out. I like this, right? Let's get out some myths, because I like getting the myths out the way. If something was really wrong, I'd know. Nope. That's what it's called, silent killer. Get that out of here. Going to the doctor means something must already be wrong. Again, this is what y'all think, right? And this may sound like a wild myth, but this is how a lot of y'all are telling me, right? When I talk to y'all, a lot of y'all are like, hey, I don't want to go to the doctor because once I go to the doctor, I know they're going to find something wrong with me. No. You don't want to go to the doctor because you know for years something's been wrong with you, but you don't want that confirmation. So it's not that the doctor, right, found something like out of nowhere. No, your body been telling you, hey, you know what? You don't feel great. You're a little more fatigued. Your bowel habits ain't the same, right? Like your body been telling you those things that you try to ignore it. So now you've trying to reverse psychology your way out of going to the doctor. Oh, I'm not going to go to the doctor because they're just going to find something wrong with me. No, your body's saying, hey, something is wrong. And I'm trying to not let you get to the point where you have a heart attack or stroke before you go to see a doctor. So maybe you should go see a doctor, right? Like, that's the big thing. This is big on taking supplements and working out. It is enough. I talked about this before. I actually talked about this in my book, Your Health, Your Choice, Your Future, where we talk about the fact that, hey, a lot of y'all think that if y'all take your supplements and your minerals, everything's okay. And I've taken care of patients who were bodybuilders, weightlifters. They lived in the gym and they still had heart attacks. They still needed triple bypass surgery, right? Because because again, silent killer is a silent killer. Silent killer don't care that you go to the gym. It's happy that you do, right? Because at least it affects the diet and weight. But silent killer don't affect it. If you got the disease, you got some disease process that's kicking your butt, right? So that's good. That's why I want to make sure, right? When it comes to men, right? I want you to be as diligent in your health maintenance as you are in your cart maintenance. Diligent in your health maintenance as you are in your yard, right? Diligent in your, like, I want you to be just that diligent. Right. Like, again, if your car says I need your oil change every 3,000 miles, right? Think about when your body says, hey, I need to get that checkup every quarter, right? Like every 6 months, think about it in that same approach, right? So again, let's recap before we get up out of here, y'all. Right? Just remember, 5 silent killers, right, that are health risks that we should not be ignoring. Not this year, not next year, not next, like we should not be ignoring anymore. High blood pressure, number one. Number two, heart disease. Yep, that's right. That's right. Number two, heart disease. Number three, diabetes, of course. Number four, cancer. And number five, depression, but more importantly, just mental health, right? These are just this, right? It's not all of them, but like if we get a hold of these five, right? If you get a hold of these five, guess what? We'll be living longer and we'll catch up to the women, yo. We will catch up to the women. We'll close that gap as far as the mortality rate. We'll close the gap, right? If we just do these things, right? Focus on those five things there. If y'all have not seen a doctor in like 2+ years, when you're done subscribing to this episode and hitting the notification bell, make sure you go take care of that. Right, make sure you go hit that. Like, hey, let me go call. In fact, let me go listen to the last episode where Dr. Pierre gave me 3 things I need to do to prepare me for that visit. Let me go listen to that last episode. Let me stop playing games here. Right, like that's how we're gonna do. That's how we're gonna attack the date. Right, as we continue to move forward, especially this Men's Health Month. I want us to be Men's Health Year. Right, Men's Health Decade, right? Like that's how I want it to be. I'm selfish, right? Like I don't want just a month anymore. I want the year, I want the decade. Like I want it to be our time, but it can't be our time if we're not getting our health together. Yeah, it is what it is, right? I'm Dr. Barry Pierre, yours truly. Y'all stay blessed and have a great evening.